Professor, are there any particular, or rather, are there any more common heart diseases that that affect people?
Look, heart failure is one of those ones. It's often undetected, so the true numbers are not there. But certainly, heart failure has become more and more recognized as one of those conditions. And then, of course, heart attacks are it's very common. I mean, that is super common. So I would say that is really quite high on the list as well.
One of the many things that I hear many people think to themselves, because they talk about it, I'll call these the braai conversations, or the having a cup of coffee conversations, where people say that heart disease it's reversible. You can reverse it. All you need to do is do this, do that, or do the other. But is it a irreversible or reversible condition?
No, it's not entirely true. I think that people use the term reversible quite loosely. Essentially, what it is that if you're able to reduce your risk, then you might reduce some of the damage or further damage to the heart muscle. So basically, the way it works is, if you have had a heart attack, or you've had some other circulatory condition, like heart failure, for example, then what happens is that you're a smoker, and you drink alcohol excessively, and so on and so forth, you can reduce your risk by almost 90%, for example, over a 2 to 5 year period, if you stop smoking and if you stop excessive alcohol use. Yes, you can. And if you take your medication as prescribed by the doctor, by your specialist. So you see, it's not reversible, but you can certainly increase your lifespan by a good 1 or 2 decades.
Professor, there's no value you could place on that. That is a priceless return on investment by stopping excessive drinking and stopping cigarette smoking.